Sure. Well, thanks for this opportunity to tell you a little bit about the paper. I'm very excited about it. In terms of the motivation of the paper really has been rooted in my experience in industry, and then, of course, in working with practitioners in the healthcare space and other academic colleagues. Now, probably for going on 23 or 24 years. And through that process, identifying a number of factors that inhibit the coordination of information, material, and financial flows in healthcare delivery, or what we could think of as the healthcare supply chain. We've noticed over time that governments, of course, play an enormous role in impacting these supply chain flows because they're not only regulators of this industry, which I think we all probably have at least a tangential understanding that the healthcare industry in all countries is fairly heavily regulated relative to other industries. But the governments serve not only as regulators, but also in many countries as the industry's largest customer. For example, in the United States here, the Centers for Medicare and Medicaid Services, or the federal government, and if you consider government employees, pay for nearly half of the health care that's delivered in the United States. So, because of these factors, they have tremendous influence on the healthcare delivery supply chain. As an example, the electronic medical records in healthcare delivery now are getting quite a bit of attention. And if you think back to just the basic technology of an EMR, an electronic medical record, the technology has existed since probably the mid-1990s. Matter of fact, I had a friend who had the unfortunate circumstance of owning an EMR company in the late 1990s that failed because at that point in time, there was really no customer for technology in healthcare. In other words, there was no clear revenue stream to lead to, or efficiency to lead to a return on investment. However, from a governmental perspective, about 9 years ago, 10 years ago, in the United States, the HITECH Act was passed, and this linked the use of the meaningful use of electronic medical records for hospitals to payment systems. So now there is actually a clear incentive or disincentive for hospitals not to adopt EMRs. So now today, the technology-enabled environment that exists within the healthcare delivery supply chain is substantially different than it was prior to that legislation. So as supply chain researchers, it seems like this is a super important context to study. There are interesting problems that exist that we've been really adept at addressing and developing thought leadership in terms of improving outcomes related to cost, quality, customer satisfaction, all of which are important issues in healthcare today. So when Professor Fugit asked me if I'd be interested in organizing some of these ideas and working on a paper, I was thrilled and very appreciative for the opportunity. Yeah, well, the paper makes a few, I hope, contributions that other researchers and certainly practitioners will find useful and important in their work. The first is that healthcare delivery as a supply chain has not received a tremendous amount of attention. In the healthcare operations and healthcare IT space, there's been quite a bit of growth from the perspective of research attention over the last probably 6 to 8 years. But thinking about healthcare delivery as a supply chain is still fairly nascent. So the first, contribution I think the paper makes or attempts to make is that it conceptualizes the healthcare delivery supply chain really in 3 phases, of course, or 3 tiers: the upstream, midstream, and downstream, as we're familiar with, supply chain vernacular. And then it focuses very intently on the downstream, looking at interactions or the coordination of information, material, and financial exchanges among physicians, hospitals as the focal firm, and of course, patients. And in this supply chain, there are several barriers that impede that coordination of flows. The paper then ultimately looks at how the unique characteristics that exist in that healthcare delivery supply chain, for example, the influence of physicians in the supply chain. If you think this through, it probably is somewhat intuitive that physicians have an incredible influence on cost outcomes for hospitals, quality outcomes for hospitals, certainly patient satisfaction or patient experience outcome for hospitals. But at the same time, the way physicians are compensated or paid is oftentimes very fragmented or disconnected from the hospitals. So, some researchers have actually said that, hospitals represent a context unlike any other because a key actor in the supply chain that influences their outcomes are not financially aligned or are not necessarily even employed by the hospitals within which they work. Uh, and when you think about those unique characteristics, then you couple on some of the industry regulations that are well intended but sometimes inhibit coordination, you can create some very interesting challenges. For example, if you think about length of stay, so this is the amount of time a patient spends in a hospital stay for inpatient. This is thought of in academic research as a key measure of quality. So in practice, of course, healthcare operations and supply chain leaders want to work to improve length of stay. In other words, reduce length of stay. Well, in the United States, the Office of Inspector General actually has regulation that precludes, incentivizing physicians to work on reducing length of stay because it's viewed as having the potential to reduce quality or reduce service to patients. So there are these inherent, while well-intended, sometimes regulations that have unintended consequences in terms of inhibiting coordination and creating interesting problems or challenges for supply chain researchers to work on. Also, third, thanks to the review process, which was an excellent review process, this is truly a paper that was a team effort. Um, the paper now discusses, in a very universal nature, the challenges that exist globally related to healthcare delivery, and it presents some ideas about how various governments have approached trying to manage the healthcare delivery system. This is really important, I think, and it was just an enormous addition. I'm so appreciative to the review process for adding this, because what it does now is really two things. One, it creates opportunities for supply chain researchers to do comparative analyses of the different governmental approaches to managing coordination in healthcare delivery. But two, it also helps us from a generalizability perspective to understand where and where we cannot generalize our findings. So I think that was very important. Great. Yeah. So in terms of our, future, our next steps moving forward, I believe supply chain researchers have just a tremendous amount to contribute in the supply chain space. The problems are large, the challenges are large, and the outcomes are incredibly important to all of us. And when you consider supply chain not necessarily as a functional area within an organization, but as an academic or scientific discipline, in other words, viewed very broadly about improving flows around information, material, and financial exchanges, as a scientific discipline, we have tremendous contributions to make to improving those flows in healthcare delivery. Um, I also think that moving forward, what makes our work really key is the notion of context. You'll notice that the paper delves fairly deeply, I hope, into the context of healthcare delivery and unpacking, some of the important factors that are contextual to consider. In other words, a lot of times when I present my work in practitioner conferences in healthcare, you'll hear statements like, well, we're different and we're not producing Toyota Camrys here, so we can't do that. And you know what? As opposed to just dismissing those objections, there's a lot of validity actually to that. Obviously, a patient is not a fastener in a automobile manufacturing process, right? So the point is that it's important as supply chain researchers that we deeply understand the context and then we adapt what we have learned largely in the manufacturing space to the healthcare delivery space. There are areas where our learnings from manufacturing, traditional supply chains, I think, port very easily. There are areas or challenges specifically related to patient care and working with physicians in patient care, more in the downstream, where there's a tremendous amount of adaptation that needs to take place. And then there are still other areas where our learnings, frankly, are not applicable because of these unique nuances. So the key is to consider, I think, context. For example, if we were studying classroom technology and classroom use of technology among students, if a professor had a policy that said, hey, no laptops in my classroom, well, that would clearly impact our research, right? So we have similar, I think, analogous types of factors that we need to consider in healthcare in order to allow us to really make tremendous contributions. And then finally, I think we as supply chain researchers and as a field are so well positioned to contribute in this space because we've developed thought leadership and expertise in key constructs that are important in healthcare delivery. Constructs like integration, constructs like information systems and IT use, process improvement, governance in the supply chain is an enormous issue in healthcare. Relationship management, whether it be supplier relationship management or customer relationship management, are important factors when you think about some of the fragmentation that exists in healthcare delivery, again, around the globe. So I think that as supply chain researchers, we have just tremendous scope and a wonderful opportunity to help healthcare leaders to improve the performance of their organizations in a time when they've never, frankly, faced more pressure to improve cost, quality, and patient experience around the globe.